Nursing and midwifery intracranial birth injuries. Intracranial birth injuries. Intracranial birth injuries. Definition: intraventricular hemorrhage is the bleeding inside or around the ventricles in the brain. Ventricles are the spaces in the brain that contain the cerebral spinal fluid. This bleeding in the brain can put pressure on the nerve cells and damages them. Severe damage of the cells can lead to brain injury. These are by far the most important birth injuries, and they are a common cause of most fetal death and morbidity, while extensive laceration involving blood vessels and causing gross cerebral hemorrhage are likely to be fatal during or shortly after birth. Non-fetal injuries may result in permanent disability such as cerebral palsy, hydrocephalus, and mental subnormalities. Types of intracranial injuries: 1. Subdural hemorrhage. 2. Intraventricular hemorrhage. Nursing and midwifery intracranial birth injuries. Valgus cerebri. Folds of dura mater. Dentorium cerebelli. The vein of Galen. Intracranial membranes and venous sinuses. Causes of intracranial injuries. 1. Trauma to the fetal skull. This can be direct to the fetal skull or indirect if the mother gets an accident during pregnancy. During instrumental delivery like in forceps and vacuum delivery. Nursing and midwifery intracranial birth injuries. 2. Prematurity, IVF and vitro fertilization. This increases the odds of multiple gestation and consequently the risk of preterm labor. 3. Hypoxia. Oxygen lack into the tissues leading to venous engorgement as a result of excess carbon dioxide accumulation. The bleeding can occur because blood vessels in the brain of the baby are very fragile and easily break. Usually all intraventricular hemorrhages occur in the first few days of life. Rapid compression seen in precipitate labor and after coming head and breech delivery. There are 4 grades depending on the amount of bleeding. Grade 1, germinal matrix hemorrhage. The bleeding occurs in a small area of the ventricle. Grade 2, bleeding also occurs inside the ventricles but without ventricular dilation. Grade 3, ventricles are enlarged by blood. There is an acute ventricular dilation. Grade 4, bleeding occurs in the brain tissues around the ventricles and the hemorrhage expands from the ventricles to parenchyma. Nursing and midwifery intracranial birth injuries. Grades 1 and 2 are the most common and often the baby has no other complications. Grades 3 and 4 are the most serious and may result into a long-term brain injury to the baby. Signs and symptoms: poor perfusion, respiratory distress like tachypnea and retraction, altered mental status, decreased responsiveness or coma, convulsions, lethargy, feeding difficulties, irritability, bulging fontanelle, high-pitched cry, respiration, difficult granting respiration, labored breathing due to excessive mucus. Sometimes the breathing is shallow, rapid, and irregular. There may be granting with attack of apnea and cyanosis. The difficult breathing may lead to worries and anxious on the baby's face, which is exhibited by wrinkling of. Nursing and midwifery intracranial birth injuries. There may be head retraction with rigid neck with tense or spongy fontanelles. Risk factors: certain babies are more likely to have intraventricular hemorrhage, which include premature babies, low birth weight babies, babies with breathing problems such as hyaline membrane diseases, babies who have other complications of being premature, labor and delivery problems, genetic background, head injury, maternal infections, high blood pressure in the mother. Management: nursing care. No specific treatment, but we manage or treat according to any problem that will make the condition worse. Admit and NICU it as a neonatal emergency which require nursing and midwifery intracranial birth injuries. Administration of anticonvulsant to prevent convulsion. Vital observations preferable using electronic monitors to minimize handling that can provoke convulsion. Incubator nursing is of best choice because it gives the baby utmost maximum care, quietness, and intensive care needed. Ensure quietness and remove all unnecessary disturbing stimuli. Handling of the baby should be minimal to avoid provoking convulsions. The infant is turned from side to side during feeding time. Bathing, weighing, and measuring of the baby can be postponed until condition is stabilized. Diligent observations, charting as mandatory. Vital signs are observed and recorded 4 hourly, i.e. respiration, color, temperature, hot, apex beat, turning, change of dirty clothes, and feeding are done at the same time to reduce handling. Feeding is done through nasogastric tube with expressed breast milk. Inform a pediatrician who will order for investigations. Nursing and midwifery intracranial birth injuries. Doctor will prescribe medications for the treatment according to the investigation and results. General nursing care. Prevention of infection by maintaining aseptic technique during invasive procedure and general care. Isolation of the infectious cases. Control of visitors on the ward. Provision of warmth. Baby is put in a warm incubator to prevent hypothermia. Hygiene care. Change soiled and wet clothes. Top untailing of the baby, especially areas of skin folds as feeding is delayed. Psychological care of the mother. Mother is reassured, counseled on baby's condition and given the feedback of all that is happening. Therapies that will be employed are volume expanders with colloid or crystalloid, or frequently sedation is one. Nursing and midwifery intracranial birth injuries. Adrenaline can be used as second or third line of treatment, usually in addition to dopamine. Supportive care like oxygen administration if there is need. Surgery in severe cases sometimes to stabilize the condition, like putting a shunt to drain the fluid. However, this surgery is rarely needed in babies because their skulls are very flexible. Possible complications are likely to occur if the baby is grade 3 or 4. Intraventricular hemorrhage. Development problems like delays. Hydrocephalus. Long-term brain injury. Convulsive disorders. Neurological sequels ranging from school performance to complete cerebral palsy. Nursing and midwifery intracranial birth injuries. Sometimes it is not possible to prevent intraventricular hemorrhage from occurring, but if a mother is at risk of early delivery, then give the corticosteroids to lower the risk between 24-34 weeks. Great advancement in the care of the sick and premature. New babies. Avoid instrumental and forceps delivery. No. Use of electronic monitor cause less disturbance to the baby. Therefore, it should be used where it is available.